Hello, class. This is Deshawn Janae Jackson, and I am here to discuss the great practices to help Black people with life and mental health. Improving mental health incomes. Adaptation, or the capability to adapt to changes, is very important, not just for survival purposes, but it helps those to maintain a healthy and yet balanced lifestyle. Researchers also suggest that identity and cultural factors go hand in hand when it comes to adjusting from childhood to teenager years and to adulthood. How to improve this? The American Psychological Association help authorities to gain knowledge about the field of psychology so they are able to provide proper care for their patients. The APA are also in charge of many programs that highlights the guidelines while creating opportunities for those that are needed in special help. One of the programs are called the Office of Ethnic Minorities Affairs. This program promotes the effect that culture and ethnicities have on behavior. Increasing positive racial and ethnic identity and racial socialization. Racial socialization leads to racial identity, which provides a sense of belonging and helps them figure out who they are. This gives this gives individuals the opportunity to point out familiar social groups. Racial socialization is also important because it helps children that are African descent to cope with discrimination and racism from their race and others. How we do that? Rates of patches programs are simply to remove children that are living in unusual environments and teach them on who they are. Increasing pro-social behavior and decreasing antisocial behavior. Pro-social behavior are considered to be behavior that benefits others. This behavior includes sharing, donating, and volunteering, and so on. Obeying commands and following social accepted behavior are also considered to be pro-social behavior, while antisocial behavior are disruptive actions that are known of being hostile and aggressive towards others. How to keep pro-social and throw away antisocial. The Ambon Aya Youth Project is a program that lowers the rates of dangerous behavior among African American children in the 5th grade through 8th grade. This is an Afrocentric social development program that promotes nonviolence, educate about sex accept abstinence, and encourage non-drug and alcohol use. The 3 levels. The social development curriculum focused on reducing risky behaviors such as violence, substance abuse, and unsafe sexual practices. The program taught cognitive behavioral skills to build self-esteem, empathy, and to manage stress and anxiety. The school community interventions, just like the social development, this is for parental support and school climate and community components. The health enhancement curriculum is to focus on promoting healthy behaviors relating to nutrients, physical activities, healthcare, and cultural pride with the help of health educators. Improving relationships. The importance of relationships is to help individuals to maintain psychological and social well-being. Interpersonal skills and the elements that help develop a relationship can either make you or break you. The different types of relationships. When talking about relationships, researchers encourage relationships among people of African descent are rather to be considered exchange and communal relationships. Exchange relations are relations between two people that gives with the hope of receiving. However, they are not equivalent. This relationship usually little to no emotions, while communal relationships are relations between two people, one having the feeling of being responsible of someone else. This party usually does not look for anything in return. This certain relationship, however, includes emotional and intimate feelings. Peer relationships. Peer relationships are also crucial to one's psychological and social well-being, especially teenagers. The people that they call friends are supposed to provide them with support and help. How we can increase this factor? Programs such as Sisters of Nia and Brothers of Ujima. Sisters of Nia is about uplifting cultural identity and pride. This program also increases the positivity of relationships that are able to be met the needs of African American teenager girls. Brothers of Ujima is a program just like Sister of Nia. It is designed to uplift and encourage African American teenager boys to have a more positive relationship while displaying pro-social behavior. How can these ideas help with Black children today? Relationships. Just like the programs Sister of Nia and Brother of Ujima are to help guide teenager boys and girls. These kind of programs are indeed great for children when they are going through puberty. This is a cool way for them to feel comfortable of opening up by gaining more trusting relationships. This particular resource can also be useful for college students who are in need of guidance. Pro-social and antisocial behaviors. Like the program A-Bond A-Ya Youth Project, also known as AAYA, is to encourage pro-social behaviors and decrease the likelihood of antisocial behaviors. Programs like this should aim for children of the age of 8 through 13. This is useful because this gives them insight on the importance of interpersonal skills and the power of helping one another in their community. Racial and ethnic identity. Programs just like rites of passage programs. These certain programs can give African American children the opportunity to experience things in places away from home, such as experiencing or going to a new environment. Camps like this should be created to help children and teenagers reach a foundational level of independence and identity. Mental health incomes. Programs just like the Office of Ethnic Minorities Affairs is viewed and shared with the curriculum as a health class. Mental health should be indeed talked about when discussing about the topic of health. Being educated on mental health is a wide awakening for the strength and importance that mental health holds. While also discussing the topics on mental health, it is suggested to talk about ways to handle it and what to look out for. These questions are for you. Question 1. Do you think parents should be required to take a mental health class for their children? Question 2. What are some effective ways that you can use to keep people's attention when talking about mental health? And question 3. What are some characteristics that you look for in a role model for teenagers?